Hey, Andy.
Hello, hello.
Welcome. Come in.
Thank you. How are you?
All right. Doing great, man. Doing great.
All right. Are you ready for your 73 questions?
Wow. All right. You can hit me anytime. We'll do it.
All right. So let's get started. What is your
right.
name?
My name is Matt Threadgill.
And what is your specialty?
I'm a pediatrician.
And how many years have you been practicing?
I've been practicing 10 years in private practice.
All right. And where did you go to undergrad?
Went to undergrad at the University of Georgia in Athens.
And medical school?
Medical school at the Medical College of Georgia.
Nice. I'm familiar with that a bit.
Yeah, I hope so.
Did you take any gap years before going to medical school?
I did not. I went straight from from college to medical school.
What was your favorite part of medical school?
My favorite part of medical school would have to have been the community of brothers, the brotherhood we had amongst each other in my class. That's probably the thing that sticks out the most.
Very well said. What specialty did you think you were going to go into on your first day of med school?
Honestly, I thought family medicine was probably what was going to be the best for me. Let's wander around here in the kitchen.
Sure.
But I didn't know much about it other than having hung out with my family physician for a little bit here and there before I went to medical school. So didn't have a good clue about what that looked like.
All right. Well, what changed your mind about that specialty, family medicine?
Well, I actually loved family medicine. I did a family medicine rotation at a very rural site in Edgefield County, just up the road here, and they were just this amazing family medicine staff and had me convinced that I was going to go into family medicine, but that all changed late in my third year of medical school when I rotated through pediatrics.
All right. Were there any specialties you immediately said, not for me, absolutely not?
You know, I never really had that experience in medical school. I really enjoyed every single rotation, even psychiatry. I mean, there was beauty in interviewing and learning about people's stories, and just somehow the stories just get broken, and how can we enter into that brokenness and help people through even mental illness.
That's awesome. So how long does your training as a pediatrician take after med school?
So after medical school, if you are, like me, a general pediatrician, then there's 3 years of residency after medical school.
Okay. And I guess you answered this question earlier, but are you in academics or private practice?
I'm in private practice.
And what do you like about private practice over academics?
Well, I should say we're mostly private practice. We do have medical students that do rotate through our clinic, and we occasionally have students shadowing who are thinking about medical school coming through the clinic. But private practice in general to me is just that there's a lot of focus on relationships with families that I'm not juggling a lot of other things besides my patients.
That's awesome. And I guess we'll try to keep it positive, but I do want to ask, are there any cons that you think about private practice over working in a hospital, or at least major differences?
I think every time we have a student come through, I'm always just delighted to be a part of just their formation and speaking into their life, even as it pertains to medical education. Not having that as much, that may be a con. But again, I'm made a conscious decision, to be in private practice and not in academics.
Mm-hmm. Did you consider getting any other degrees, like an MBA or an MPH?
No, an MD was that was plenty.
Enough years, right?
That was plenty of years. So, yeah.
So, what would you say is the most unique part of your specialty?
I think the most unique thing about being a pediatrician is going to be the long view, the long-term relationships that you have with people. We start with families from the very beginning, from pretty much in the delivery room, and walk with families through the better part of 18 to 20 years of raising children. And so, and we see them relatively frequently. And so I think that's a very unique part of pediatrics, is being a very close part of people's lives in just these formative years, not only for the children, but for the parents too.
That's a great answer. So
Would you like something to drink?
Sure.
Like some water?
Just
or something?
water.
Okay.
That'd be great.
All right.
Thank you.
Yep.
So why would someone choose your specialty, per se?
I think anybody who wants to choose pediatrics, you're really going to have to love preventative medicine for one. So, pediatrics is preventative medicine. We see a lot of checkups and try to prepare people for what's coming next and protect children from, disease and whatnot. So I'm going to make a cup of coffee if that's okay.
Of course.
The easy way through the Keurig. I think that's what you got to love. Preventative medicine. You've got to love kids. So if screaming children doesn't, if that puts you off a lot, then you're probably not going to enjoy a day in the clinic, because sometimes our halls sound like the London Tower about the time of Henry VIII, I think. Occasionally, there's a lot of screaming. But there's a lot of joy too. I don't mean to make it sound abysmal.
It's fine. Well, I guess that kind of answers my next question. Why would someone not choose your specialty?
Yeah. So if you get frustrated with kids, if you can't ham around with little guys, if you have trouble getting back down to that level, if you have trouble getting on your hands and knees and picking up kids, you probably want to stay away.
Well said. Are there any stereotypes of your specialty?
I think probably one of the biggest stereotypes of our specialty is that we're just kind of softies, or maybe we're the nice guys. I think that was certainly what we thought of the pediatrics residents and the attendings when we were rotating through pediatrics when I was in medical school, is that they weren't the ones who were making you feel really bad for not knowing something. When they ask you questions, it seemed like they wanted you to learn and not just this vindictive spirit. Like if you're on a surgery rotation or something, and not to speak ill of surgeons. Love the good surgeons, But yeah, I think that's probably a stereotype.
Yeah. Well, would you say in particular, are the stereotypes true at all in your experience?
Yeah, I think in general, I think probably the flavor of people who go into pediatrics are kind of natural softies, because we love children and we're probably more gentle spirits, and and that's not universal, but sometimes you can be something. It's easy to provoke the anger of the gentle spirits when you mistreat children, and we do get passionate about children, especially when they're at the victims of abuse and other things like that. So we're not always sweet and kind.
Well said. Now, you touched on this earlier, but even though you work in private practice, you are still able to interact with med students. What does that exactly look like?
So we actually interact with students on a lot of levels. So like we said before, in the clinic, we take students about every 6 weeks. We'll take students for a couple week blocks, and they'll see patients with us, and we'll help in their training, and they'll make an assessment, and we'll talk about plans. And so they're learning the ins and outs of pediatric medicine through the clinic, which is, in private practice, it's a much faster pace than in the academic setting. So they get that flavor too at our clinic. But we also do a lot of other stuff with students outside of the clinic. So for years we've been involved with student Bible studies, and meeting with students one-on-one a lot through various stages of their training. So I've really enjoyed having medical students as a part of mine and my family's life for the last really 15 years. So.
That's awesome. Now, some fun ones. What's the craziest question you've been pimped on?
I remember being on a trauma surgery rotation in third year medical school, and it was about 3 a.m., and I didn't know which way was up at that point. And so we got called in out of sleep for a gunshot wound. This guy had several gunshots, including one in the inguinal area, and which is kind of around the pelvis. And the surgeon was dissecting and trying to find the bullet, and he was screaming at me, "What is the order of the vessels and the nerves and the around the femoral area?" And I'm stumbling through trying to remember the nerves and all the vasculature in that particular area, and totally got it wrong. And it was partially because I probably should have studied a little more, and partially because, man, he was hard. But at 3 a.m., that was a toughie.
Can't wait. Now, are you ever nervous coming into work at all?
No, never nervous. I think there's always a little bit of an anticipation in starting clinic. Usually our schedules are pretty busy, and so you kind of see a mountain in front of you sometimes. Like, how are we going to get through? How are we going to get through and take good care of these people that are coming through the clinic today? And we always look at our schedules, and I try to make sure I think about how I'm going to time visits, because I just kind of anticipate some people needing a little more, and there's just always things that come up, and so it's just a little anticipation about how we're going to make sure we're taking good care of everybody.
Understandable.
Yeah.
All right, so here's some quick fire questions. How many patients do you see on an average day?
25 to 30.
What's the most amount of patients you've seen in a day?
Ugh. About 40, but that was not good. I would say seeing that many patients in one day is borderline dangerous, and I don't know that you're ever really taking good care of people when you're seeing patients that fast.
Do you ever have to do any procedures?
Simple procedures, yeah. I mean, we do incision and drainage of abscesses. We'll do suturing, mostly simple sutures. So, anything that's severe or going to be very cosmetically significant, we'll usually turf to the surgeons, the pediatric ER. We'll clip tongues for babies who are tongue-tied and need some help nursing. It's just simple procedures like that.
Okay. How many hours do you work in an average week?
So actually, I work 4 days a week, plus the call we take. But those days are usually long days. They're usually 10 to 12-hour days. So usually between 40 and 50 hours a week.
What time do you normally wake up?
5:30 to 6.
What time do you normally leave the clinic?
On a good day, I'm leaving around 6. On a real busy day, it's closer to 6:30 or 7. Yeah.
Okay. How many hours of sleep are you typically working on?
6 to 7.
Okay. How many hours of sleep are you working on right now?
Yeah. Probably 7. My
Okay.
wife went to breakfast early with a friend, and so Daddy was alone with the kids this morning.
That's a good day then.
It was.
So, how long does it take you to finish your patient notes at the end of the day?
I do my notes as I go along, so I don't try to tie things up at the end of the day. It takes
Smart.
a little bit longer in the room, but I feel like I'm fresher and I'm going to write a better note if I'm doing it with each patient.
So, who are you most thankful for in your care team?
Whew, man. That's a toughie, but I would say my nurses. The nurses, having a good nurse is one of the most valuable assets that anyone can have as a physician. A nurse that can anticipate your every move is really just kind of helping you to manage your schedule. So I have several great nurses, and so I'm really thankful for them. I have really good partners too, so I don't want to not say too much about them.
All
Too
right.
little.
So, what's the funniest thing you've seen in a patient chart without, violating HIPAA, of course?
Whew. Sometimes we get records from other physicians when patients, transfer or when they move and come to find a new physician. So, sometimes with these EMRs, it's really easy to click, yes or normal on the exam. And so there was one physician in particular that I'd noticed that every time I saw a chart that came from that office, even the 2-month-old males seemed to have normal prostate exams. And I thought to myself, probably a very small chance that she did a prostate exam on the 2-month-old, but that was pretty funny.
All right, so what's the most common medical advice you give to your patients?
That's a hard question because I give a lot of advice at a lot of different stages. I think probably one of the most frequent advice I give to parents is especially parents of toddlers, is just, try to be consistent with your children and be as good at encouraging them and affirming them as you are at correcting them. Because children really need both. They need consistency with affirmation and also correction, which isn't quite as fun.
Well said. What's your favorite nerdy random medical fact, if you have one?
Whew. Nerdy random medical fact. Ugh. I don't know. I'm sure that I'm a nerdy random medical doctor, but I can't think of any nerdy random medical facts.
We can come back to it.
We'll come back to it.
Yeah.
Yeah, maybe I'll pass.
So, and then I guess, we typically can't avoid talking about it right now, but how has your clinic and your specialty in particular been impacted by COVID?
So COVID, it brought a whole lot of unique challenges, that's for sure. Initially when COVID hit back in March of last year, our volume, our patient volume went way down. A lot of it was just people, sheltering in place at the time. But part of it was that they're just, as the months rolled on, we just didn't have any sick patients, which was, that's a really good thing, actually. People were, I think, either staying, being careful about washing hands, and, they just weren't getting sick because they weren't around each other. So patients were overall well. And also, I think a lot of people started weighing a little more like, well, what's worth going to the doctor for? Do I need to go to the doctor for this? Or so there was a lot, less of just the simpler stuff, which we're always glad to see. But it's really cool when parents are feeling comfortable to take care of themselves too.
Alrighty. So we've talked a lot about your life inside the clinic and in a clinical setting. How about your life when you clock out? So what is your favorite thing to do when you're not working?
Wow. So if I'm not working, I love to be outside. I mean, that's kind of my, anything outside. Right now there's a whole pile of wood in the back to use a chainsaw and chop up and split with an axe. So we like doing that. Some of my boys like to do that with me. I love to go hiking and be in the mountains. So that's kind of if I had infinite time, I would probably do a lot more of that.
Alrighty. So, do you have any kids?
I do. I have 8 children actually, which I guess is above average. So I have my oldest is 14, and then we have them kind of stair steps: boy, girl, boy, girl, boy, girl, boy, girl, boy, girl, all the way to the 6-month-old.
Alrighty. Happy full family.
Yeah.
So does your family ever ask you for random medical advice?
Oh man. Ever since I think I was a first-year medical student, I became a doctor in my family's eyes. And even now, I'm getting almost daily texts about my dad, who's in the hospital right now for a non-COVID, thank the Lord, a non-COVID related issue. But I'm having to interpret some of his lab work and whatnot, which I'm mostly qualified to do, I guess.
Yeah. So with that, what's the weirdest question a family or friend has asked you?
I don't know about the weirdest questions, but I do get some really weird pictures. Like I pretty much have to immediately delete once I look at them from families and friends who have concerns, particularly about various types of diaper rashes. So you can imagine it can be a little wacko. My phone.
Not pretty.
Yeah.
Do you have any pets?
Not anymore. We had a dog for a while, but he went to live at the grandparents' house. But we want another dog. And our cat, I think, got assaulted by a fox.
Oh no.
Yeah, that's very sad.
Well, I would say, are you a dog or a cat person then?
I'm a dog person. Yeah, the cat, he can rest in peace. We're not missing too much. Yeah.
Favorite animal, not a cat or dog?
Oh, hands down, it's birds of prey. An owl, a hawk, an eagle. They have to be the most amazing of God's creatures. I mean, to watch something that big take flight is unbelievable.
If you could have dinner with anyone in history, who would it be?
Whew. That is a hard question. Anyone in history. That's a toughie. Certainly Jesus would be probably the best guy, since he wrote history in general. But I think if you're talking about just a man, somebody I really respect is a guy named Dick Winters. He was the captain of the Band of Brothers from that series, and if you've ever read the Stephen Ambrose book, he just lived this incredible life and was a man who knew how to lead men, who knew how to sacrifice for others. He just passed away a few years ago, but I always thought he would have been a great guy to sit down with and talk to.
No. Well, at that dinner, what do you think you guys would be eating?
Definitely steak, a nice fat ribeye steak.
No? What's your favorite dish to eat? That might have answered that question.
Yeah, it'd be hard to beat that, that's for sure.
Any favorite restaurants around here?
Well, for my money, Frog Hollow Tavern there's probably not a lot of places that can get better than that. That's free advertising.
I'll have my people reach out to their people. Yeah. So, coffee, tea, or soda?
Coffee.
How much water should you be drinking every day?
8 cups. I don't usually get there, but I should.
Favorite meal as a kid?
Probably my mother's mac and cheese. Okay, every child should answer that question in the same way, actually.
What's your favorite healthy snack?
Whew. I'm kind of on these almond butter cookies, the Nature Valley. I'm kind of on those kicks right now. They're really good. Okay. I'm going to consider that health food.
Then what's your favorite guilty snack or cheat meal?
Ooh. I'm just always down for Tex-Mex, like Diablos. Yeah, Chipotle, stuff like that.
Great choice.
Yeah.
All right, controversial question. Pineapple on pizza, yes or no?
I think pizza redeems everything. Like, you could put anything on pizza, so sure.
Okay.
Yeah.
Apple or Android?
Apple. It just works.
Any artistic hobbies you keep up with?
I've always been a musician, so I like to dabble a little bit in playing the piano, and try to play some of the hammer dulcimer sometimes.
Mm-hmm. Yeah. What kind of music do you listen to in the clinic?
Man, it's kind of a mix. My son's got me on a lot of movie soundtracks now. A lot of like Christopher Nolan movie soundtracks, Hans Zimmer and stuff like that. These epic movies. My staff just kind of makes fun of me when they hear the epic movie music.
Do you ever have to put on stuff like Kids Bop or anything like that to calm your younger audience down?
My kids love to listen to Kids Bop in the car. I'm not a big fan of Kids Bop, so I try to put it on something else. This is my selfish part of me, of course.
Yeah. What's the best way that you relax after a long day?
I think just sitting by a fire with my wife and getting to catch up. Oftentimes we don't get enough time to do that, so that's one of my favorite things. Most of the time, though, if I'm sitting down and it's a long day and we get the kids in bed, I'm probably going to fall asleep on the couch in pretty short order.
Night in or go out on the town kind of person?
I'm probably more of a get out and do something kind of guy. I'm not sure on the town is the right, but I like to go to shows or take my wife on a date or do stuff. I kind of balance her. She's more of the homebody.
Indoors or outdoors person?
Definitely outdoors. Yeah, without a question.
Beach or mountains?
Mountains. I'm totally a mountain person. The beach is nice, but nothing beats the mountains.
And would you consider yourself more of an introvert or extrovert?
I'm definitely more of the extrovert. I always felt like I come alive a little more when I'm around people.
Was that personality trait a factor in you choosing your specialty?
Probably, yeah. I mean, I think when I was in medical school, I was around. It wasn't until I was in my pediatrics rotation that I really felt like I was just coming alive, just being around kids, interacting with them, getting down their level, just being a little bit of a ham. So that's kind of my outgoing personality, I guess.
Alrighty. All right, so thank you so much for your time. As we wrap up, I want to ask a few more reflective questions.
All right. You want to sit down?
Oh, sure.
Yeah. You can sit
Right,
here.
do this
and
across?
Yeah.
Perfect.
Yep.
So, what did you think you were going to be when you grew up as a kid?
I was kind of a nerdy kid. And my cousin, who was like 10 years older than me, she was an accountant, so I thought that was awesome. So I always thought I'd be an accountant. I didn't know what that meant, but.
Is there a different specialty you think you could have done?
Yeah, I mean, I would have loved family medicine, absolutely. I think really the primary care specialties are much more, seems to me, relational, having long-term relationships and really walking through life with people. And that's really where I feel like, with my own personality, is where I feel like that's one of my strengths, I guess, if that's not so bold to say. So I think primary care is definitely, I could have been happy in a lot of those specialties.
So, if you didn't do medicine, what do you think you'd be doing right now?
I don't know. I always said if I wasn't a people doctor, I'd be a good car doctor. Maybe an auto mechanic. I don't know. I also like carpentry. Carpentry has always intrigued me. Just working with my hands. That is, which seems kind of weird because I just talked about being relational. But doing stuff like that has always intrigued me. I'd love to be better at carpentry and stuff like that.
Were there any times you doubted you would make it as a doctor? No. I mean, I just kind of felt, I mean, it was hard. Medical school was hard along the way. Certainly there was places that, were super challenging, discouraging, especially when you're in the wards and you're working long hours. But, I just always knew that this was God's design. This was this place where I was meant to be. And so I just always took the next step, and here we are. So if you could change one thing about the medical field right now, what would it be?
I think I would, if I had the power to change it. I think the whole payer systems I would change. Certainly I don't think I would change it in a way that would make there be a one payer system, but there's a lot of excessive payments for seemingly minor things. I think it's ridiculous that for a procedure you get reimbursed for this exorbitant amount of money, while if I spend an hour counseling an adolescent who's just depressed and even suicidal, like that is, the value for it's not so much what you get paid, but it's the value is less. And I think the value in counseling and speaking into people's lives is so much more than if I'm just, suturing up a cut knee. There's value in all of the healing arts. And so I don't think, I don't want to undervalue anything, but I think they're just intuitive. There's a value on procedures, and I think that those who are working
through hard relational illness associated mental illness. What am I trying to say? This kind of time-consuming process that it takes to walk with people through life hardships. There's less of a value for that, and so I'd find a way to make values more equal.
Great answer. So what can a medical student do right now to prepare to go into this specialty?
I think trying to expose yourself to children, to see if you like them. You like them, that sounds awful. Yeah. What I mean by that is be a camp counselor, work with youth groups, you work with the Boys and Girls Club, volunteer at your local Y, go and volunteer at a pediatric clinic, volunteer in your church nursery. I mean, if you think you want to help and love children, then see if that's something that makes you come alive.
Great answer. So if you were to go back, would you change any of your experiences that got you to where you are right now?
No. In fact, I tell people all the time, people always ask, would you do medical school again if you had to? And I would say 100% yes. I would do medical school. That's the best 4 years of my life was in medical school. And I wouldn't change anything about it. I loved every moment of it.
It's awesome.
Yeah.
Sounds like I got some stuff to look forward to then. And finally, what would you say to the aspiring pediatric physician right now?
I would say sometimes it can be a thankless job. Sometimes we, pediatricians are just we're the lowly doctors or whatever. We're not the upper echelon of who's how much people are getting paid or whatever on the pay scale. But life is about way more than that. It's about laying down your lives for others, and especially for the vulnerable and the weak. And I think, children are the most vulnerable and the weak, and our job is to take care of children, rich and poor and of every race. And I think sometimes that can be a thankless job. But don't be dissuaded or deterred, because there's great rewards. Certainly, like I said before, every day I go to work, I'm pretty much excited to be there. And I think it's just because there's just new opportunities every day.
All right. That is awesome. Well, thank you so much, Dr. Threadgill, for your time.
Yeah, thanks for coming.
Have a great day.
Yeah. All right.